The nervous system.
Yeah, this is a big one.
It really is. So, I mean, everyone knows it's your body's command center, right?
Yeah.
I mean, think about it. Thoughts, feelings, moving around, what you sense.
Sleep, heartbeat, digestion.
Seriously, all of that. So obviously when it's working right, you feel good, you're healthy, but what happens when it goes wrong?
Well, that's where things get interesting and a little complicated, to be honest.
Definitely. And that's why we're doing this deep dive. I mean, the materials we've got here, they really focus on a few specific things like schizophrenia, bipolar disorder, depression, even get into a specific pharmaceutical product.
Right. And it can feel a bit overwhelming, all this information.
Yeah, I totally agree. So our mission today, we're going to break it down for you, make it clear, make it engaging. So you walk away feeling like, okay, I get it. I don't need a medical degree to understand this.
Exactly. We're going to take these complex topics and distill them down to the core, what you really need to know.
So let's start with the basics. Like, what is a neuron? What does it do? This is like the building block of the nervous system, right?
Absolutely. The neuron is the fundamental unit of communication in the nervous system. So picture this. Each neuron has a cell body. Think of it like the main office, right?
The headquarters.
Exactly. And branching out from the cell body, you have these little things called dendrites. You can think of them like antennas, constantly picking up signals from other neurons.
Okay, so receiving messages. Then what?
Then you have the axon. That's a longer fiber that transmits signals away from the cell body to other cells. It's kind of like a cable carrying the message.
So you've got the cell body, the dendrites, the axon, but how do these neurons actually connect and talk to each other?
That happens at a specialized junction called a synapse. It's this tiny gap between the axon of one neuron and the dendrite of another. Or sometimes the axon connects directly to the cell body of another neuron.
So it's not actually physically touching.
Right, there's a small space, and it's in this space that the magic happens.
So how do they talk across this space? What's the process?
It's actually a really cool process called chemical synaptic transmission. So the signal starts as an electrical impulse that travels down the axon of the neuron, like a little electrical charge zipping along.
So it's electrical first.
Right. Then, when this impulse reaches the synapse, it triggers the release of chemical messengers called neurotransmitters.
Oh, I've heard of those, like dopamine and serotonin.
Exactly. So think of it like this. The electrical signal comes racing down the axon, hits the end, and this causes these tiny sacs called vesicles to release their neurotransmitters into the synapse.
Okay, so these neurotransmitters get dumped into the gap between the neurons.
Right. And then they float across the synapse and bind to receptors on the receiving neuron. It's kind of like a lock and key mechanism. Each neurotransmitter has a specific shape that fits into a particular receptor.
And that binding, that triggers something in the receiving neuron.
Exactly. It can either excite the receiving neuron, making it more likely to fire its own signal, or it can inhibit it, making it less likely to fire.
Wow, it's super complex, but it makes sense. It's like a chain reaction, one neuron triggering the next.
It really is. And there are so many different types of neurotransmitters, each with its own specific function.
And that's where the different effects come in, right? Like some neurotransmitters are involved in mood, some in movement, some in memory.
Exactly. It's all about the balance and interplay of these different chemical messengers.
So what happens when that balance gets disrupted? That's where we start talking about mental disorders, right? Like schizophrenia, for example.
Exactly. Schizophrenia, as our source explains it, is characterized by a disintegration of thought processes and emotional responsiveness. Basically, the brain isn't processing information or emotions the way it typically would.
And that can lead to all sorts of challenges, right? With thinking, behavior, social interactions.
Absolutely. They're a really serious condition, and there are different types of symptoms.
Like what?
Well, you have what are called positive symptoms. These are things that are present in people with schizophrenia, but not typically in others.
Okay, so what are some examples of these positive symptoms?
The big ones are delusions, hallucinations, and disorganized thinking.
Those sound pretty intense. What exactly do they mean?
A delusion is a firmly held false belief, like believing you have special powers or that people are trying to harm you, even when there's no evidence for it.
So it's not just like a quirky belief, it's really unshakable.
Right. It's very real to the person experiencing it. And hallucinations are sensory experiences that aren't real. The most common are auditory hallucinations, like hearing voices.
That must be incredibly frightening.
It can be very distressing. And then disorganized thinking, that's when someone's thoughts are jumbled and their speech might be difficult to follow.
And our source says that these positive symptoms are often associated with a state called psychosis.
Yes, psychosis is a severe mental state where a person's perception of reality is severely distorted.
So it sounds like these positive symptoms, they're adding experiences that most people don't have. But then there are also negative symptoms, right, which are more about things that are missing.
Exactly. Negative symptoms are more about a reduction or absence of normal emotions and behaviors.
So it's not just about what someone is experiencing, but also what they're not experiencing.
Right. For example, someone might have a flat affect, meaning they show very little emotion in their facial expressions or tone of voice. Or they might have alogia, which is poverty of speech, speaking very little.
Or anhedonia, right,
So
which I've heard is the inability to experience pleasure.
exactly. And then there can also be a lack of motivation or difficulty engaging in social interactions.
It sounds like both the positive and negative symptoms can make it really difficult to function in daily life.
Definitely. Schizophrenia is a complex and challenging condition.
Okay, so that's schizophrenia. Our source material also covers bipolar disorder. So what is that in a nutshell?
Bipolar disorder is a mood disorder. It's characterized by extreme shifts in mood, energy, and activity levels. So you might have periods of intense highs, called mania, and periods of intense lows, which is depression.
Okay, so these mood swings, they're not like the typical ups and downs everyone experiences.
No, not at all. These are much more extreme. Like during a manic episode, someone might feel euphoric, have tons of energy, need very little sleep, and be very impulsive and even reckless.
And then when they're in a depressive episode?
Then it flips. They feel hopeless, lose interest in things they used to enjoy, might have trouble sleeping or sleeping too much, have low energy, and even thoughts of suicide.
So it's like riding a roller coaster. And there are different types of bipolar disorder, right?
Yeah, the main ones are bipolar A and bipolar II. The key difference is the severity of the manic episode.
Oh, okay. So how do they differ?
So in bipolar 1, you have full-blown manic episodes that can last for at least a week. They can be so intense that they might require hospitalization.
Wow. What about bipolar 2?
Bipolar 2 involves hypermanic episodes, which are less severe than mania and don't usually lead to hospitalization.
So it's a milder form.
Sort of. You still have the depressive episodes, but the elevated mood episodes aren't as extreme.
I see. And I know our source mentions that people with bipolar disorder might also experience rapid cycling. What does that mean?
Rapid cycling means having 4 or more mood episodes within a year.
Wow, that's a lot. So we've talked about schizophrenia, bipolar disorder. Our source also gets into depression. And I think most people have a basic understanding of what depression is, but what does our material tell us?
Yeah, it gets into some of the details. It says depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. It can affect how you feel, think, and behave.
And I know it goes beyond just feeling sad.
Right. It can involve a lot of different symptoms like feelings of worthlessness, guilt, fatigue, changes in sleep and appetite, difficulty concentrating.
Yeah, and in some cases, it can even lead to thoughts of death or suicide.
Right, it can be very serious. And it's often caused by a combination of factors.
Like what?
Well, genetics can play a role, your personal history, and even environmental factors like stress and trauma.
And I know our source mentions biological factors too, right? Like neurotransmitter imbalances.
Yes, specifically it talks about decreased serotonin activity. Serotonin is a neurotransmitter that's really important for mood regulation.
So if you don't have enough serotonin activity, that could contribute to depression.
Right. It's not the whole story, but it's one piece of the puzzle.
So we've covered a lot about how things can go wrong with the nervous system. But our source material also delves into a specific pharmaceutical product for these conditions, Quitin and Quitin XR. Just want to make sure I'm saying it right. It's Qutin.
That's it, Qutin. It's made by Werrick Pharmaceuticals, and the generic name is Quetiapine fumarate.
Okay, so it comes in two forms. Immediate release, which is just Quitin, and extended release, which is Quitin XR.
Exactly, and they come in different strengths and pack sizes.
I noticed our source even lists some prices, but those will probably need updating.
Probably, yeah. But anyway, for Quitin tablets, you have strengths of 25 milligrams, 100 milligrams, and 200 milligrams. And for Quitin XR, the strengths are 150, 200, and 300 milligrams.
So now that we've got the basics down, let's talk about how Quitin actually works in the body. What's its mechanism of action?
Well, quetiapine is an atypical antipsychotic. It works by blocking dopamine and serotonin receptors in the brain.
Oh, okay. So it interferes with the action of those neurotransmitters we were talking about earlier.
Right. And it seems to have a higher affinity for serotonin receptors, meaning it binds more strongly to those.
So that probably plays a role in its effectiveness for treating mood disorders.
Most likely. And this binding to receptors, it helps to regulate the activity of certain brain circuits that are thought to be involved in conditions like schizophrenia, bipolar disorder, and depression.
So what exactly is Quetiapine approved to treat?
Well, for immediate release Quitin, it's approved for schizophrenia and bipolar disorder, specifically for acute manic episodes associated with bipolar I disorder and for depressive episodes.
Okay, so it can help manage both the highs and lows of bipolar disorder.
Exactly. And it can be used either alone as monotherapy or with other mood stabilizers like lithium.
What about Quitin XR? Does it have the same indications?
It's similar, but Quitin XR actually has an additional indication. It can also be used as adjunctive therapy for major depressive disorder.
What does adjunctive therapy mean?
It means it's used along with another antidepressant medication. So basically, if someone isn't responding well to an antidepressant alone, adding Quitin XR might help.
Interesting. So it's not a first-line treatment for depression, but it can be added on if needed.
Exactly. And the source also mentions using Quitin for kids and teens with schizophrenia and bipolar disorder.
Oh, right. Any special considerations there?
Yeah, it emphasizes the need for a thorough evaluation before starting any medication. And it stresses that medication should only be one part of a comprehensive treatment plan.
So it's not just about medicating the child, it's about a holistic approach.
Right, exactly. It's about addressing their psychological, educational, and social needs as well.
Makes sense. So we know what it treats, but what about how the body processes it? That's the pharmacokinetics, right?
Yes, that's looking at how the drug is absorbed, distributed, metabolized, and eliminated by the body. So for immediate release Quitin, it reaches its peak concentration in the blood about an hour and a half after you take it.
And what about Quitin XR?
Quitin XR takes longer, about 6 hours to reach its peak, and the overall concentration in the blood is lower compared to the immediate release.
Okay, so it's a slower, more sustained release.
Exactly. That's what allows it to be taken once a day. Both forms are metabolized primarily in the liver and eliminated mostly through urine.
Now, before someone starts taking any medication, it's crucial to know about potential side effects and contraindications. What does the source tell us about that for Quitin and Quitin XR?
Well, the main contraindication, which is when you wouldn't use the drug, is a hypersensitivity to any of the ingredients. So basically, if you're allergic to it.
That makes sense. What about side effects? What are some of the common ones?
The most common ones for adults are drowsiness, dry mouth, dizziness, constipation. Some people also experience asthenia, which is just a general feeling of weakness or lack of energy.
Okay, and what about for kids?
For children and adolescents, the most common ones were sleepiness, dizziness, fatigue, increased appetite, and some gastrointestinal issues like nausea, vomiting, and dry mouth.
Seems like drowsiness is a pretty common side effect across the board.
Yeah, that's something to be aware of. It's also important to monitor for metabolic changes like weight gain, high blood sugar, and changes in cholesterol levels.
Are there any serious, less common side effects that people should be aware of?
Yeah, there are a few. The source lists a bunch of warnings. One is for something called neuroleptic malignant syndrome. It's rare, but it's a life-threatening condition that can cause fever, muscle rigidity, and changes in mental status.
Okay, that sounds serious. What else?
There's also a risk of tardive dyskinesia, which is a movement disorder that can cause involuntary movements, usually of the face and tongue. And there's a small risk of seizures.
So definitely important to be aware of those possibilities and contact a doctor immediately if any unusual symptoms occur.
Absolutely. And it's also important to mention that Quitin can interact with other medications, especially drugs that affect the CYP3A4 enzyme system, which is the main enzyme involved in metabolizing quetiapine.
So if someone's taking other medications, it's important to talk to their doctor about potential interactions.
Definitely. And the source also talks about what happens if someone takes too much Quitin.
Overdosing.
Yeah. It seems like people have survived overdoses of up to 30 grams, which is a lot, but obviously it's not something to mess around with.
Of course. What are the symptoms of an overdose?
Mostly just exaggerated side effects like drowsiness, rapid heart rate, low blood pressure.
So always important to take medication as prescribed and keep it out of reach of children. Let's shift gears a bit now and talk about this extended release technology behind Quitin XR. What's the big deal with that?
The idea with extended release formulations is to deliver the medication slowly and steadily over a longer period. This helps to maintain a more constant level of the drug in the bloodstream.
So instead of having peaks and valleys in the drug concentration, it's more even.
Exactly. And that can be really beneficial for several reasons. For one, it often means you only have to take the medication once a day, which is more convenient.
Right. Much easier to remember and stick to.
Exactly. And it can also help to reduce side effects. Sometimes those side effects are actually caused by those peaks in drug concentration you get with immediate release formulations.
I see. So by smoothing out those peaks and valleys, you can minimize those side effects.
That's the idea. And the source even provides a little table comparing XR to IR formulations just to highlight those differences.
Okay, so we've got Quitin and Quitin XR out in the market. But are they the only options? What about competitors?
No, there are other Quetiapine products out there. Our source lists a few: Queasel, Seroquel, and Calm. So it's not like Quitin is the only game in town.
Right, so doctors and patients have choices. Now, what about 𝓢𝓾𝓰 Pharmaceuticals, the company behind Quitin? What are their sales and marketing objectives?
Well, they're really targeting psychiatrists, neurophysicians, and what they call Class A GPs.
So doctors who specialize in mental health conditions.
Exactly. And they're focusing on schizophrenia and bipolar disorder as the main indications. They're also highlighting some potential advantages of Quitin, like a possibly better profile for diabetes and weight gain compared to other antipsychotics.
And they're promoting both Quitin and Quitin XR.
Yep. They're pushing the extended release technology as a big selling point for Quitin XR, emphasizing the convenience and potential for fewer side effects.
Makes sense. And they even have a specific detailing pattern outlined for how sales reps should talk to doctors about Quitin.
Yeah, it's a pretty structured approach. It starts with recognizing the challenges doctors face in managing these conditions, then probing to understand their current practices, and then presenting Quitin as a solution.
And ultimately, the goal is to get doctors to prescribe Quitin, right?
Exactly. They even specifically mention trying to get Quitin on discharge slips, so patients are already on it when they leave the hospital.
So all in all, we've really covered a lot of ground here. We started with the basics of the nervous system, those incredible neurons, and their communication pathways.
Then we explored how disruptions in those pathways can lead to some serious mental health conditions like schizophrenia, bipolar disorder, and depression.
And we learned about Quitin and Quitin XR, how they work, what they treat, the potential side effects, and even the marketing strategies behind them. It's fascinating how our understanding of the brain translates into treatments for these really challenging conditions.
It really is, and it's constantly evolving.
And that brings us to our final thought for you today. We've focused a lot on the biological and pharmaceutical aspects of mental health. But what about the bigger picture? What other factors do you think might significantly impact mental well-being? Things like social support, lifestyle choices, even environmental factors. It's clear that there's much more to explore beyond just medication.
Absolutely. It's a complex interplay of factors, and as our understanding of the brain continues to grow, it raises so many questions about how treatments might evolve in the future.